1. A nurse is preparing to care for a patient with C. difficile. Which is the most appropriate method of hand hygiene after care? 1. Using alcohol-based hand sanitizer. 2. Washing hands with soap and water. 3. Wearing gloves only. 4. Rinsing hands with water only. Answer: washing hands with soap and water. Rationale: alcohol-based hand sanitizers are not effective against C. difficile spores. Soap and water are required to physically remove spores from the skin. 2. A patient with tuberculosis is being transferred for a chest x-ray. What infection control action must the nurse take before transport? 1. Place an N95 mask on the patient. 2. Have the nurse wear a surgical mask. 3. Delay the procedure until cleared. 4. Notify radiology to wear gloves. Answer: place an N95 mask on the patient. Rationale: patients with airborne infections like TB should wear a surgical mask during transport to reduce transmission risk. 3. A nurse is caring for multiple patients. Which task can be delegated to the UAP to prevent infection? 1. Administering for antibiotics. 2. Changing a sterile dressing. 3. Assisting with bathing a patient on contact precautions. 4. Assessing a surgical site. Answer: assisting with bathing a patient on contact precautions. Rationale: bathing can be delegated to a UAP as long as proper PPE and infection control measures are followed. 4. A nurse is teaching a new staff member about infection prevention. Which statement requires correction? 1. Hand hygiene is the most important way to prevent infection. 2. Gloves replace the need for hand washing. 3. PPE should be removed before leaving the room. 4. Contaminated linens should go in leak-proof bags. Answer: gloves replace the need for hand washing. Rationale: gloves do not replace hand hygiene. Hands should be washed before and after glove use. 5. A nurse is caring for a patient with herpes zoster. What is the most appropriate infection control measure? 1. Place the patient on standard precautions. 2. Use airborne and contact precautions. 3. Wear a surgical mask only, for no precautions are needed. Answer: use airborne and contact precautions. Rationale: disseminated herpes zoster requires both airborne and contact precautions due to the risk of aerosolized virus particles. 6. A nurse notes that the sterile field was contaminated during a dressing change. What is the most appropriate action? 1. Continue the procedure using clean technique. 2. Notify the provider. 3. Restart the sterile procedure with a new kit. 4. Document the contamination and proceed. Answer: restart the sterile procedure with a new kit. Rationale: once sterility is compromised, the procedure must be restarted using new sterile equipment to prevent infection. 7. A patient is in protective isolation due to severe neutropenia. Which nursing intervention is most appropriate? 1. Allow fresh flowers in the room. 2. Ensure all visitors wear gowns and masks. 3. Keep windows open for fresh air. 4. Serve unwashed raw vegetables. Answer: ensure all visitors wear gowns and masks. Rationale: protective isolation requires barrier precautions to protect immunocompromised patients from external sources of infection. 8. A nurse is performing a urinary catheter insertion. Which action increases the risk of infection? 1. Maintaining a sterile field. 2. Cleansing the meatus before insertion. 3. Touching the catheter tip with gloved hands. 4. Using sterile gloves. Answer: touching the catheter tip with gloved hands. Rationale: the catheter tip must remain sterile. Touching it, even with sterile gloves, risks contamination and infection. 9. A patient has been diagnosed with MRSA in a wound. What infection control precaution should the nurse implement? 1. Airborne. 2. Contact. 3. Droplet for protective. Answer: contact precautions. Rationale: MRSA in wounds spreads through direct and indirect contact, requiring contact precautions. 10. A nurse is caring for a patient with a draining abscess. What PPE is necessary when performing wound care? 1 gloves and surgical mask. 2 gloves only. 3 gloves, gown, and face shield. For no PPE needed. Answer: gloves, gown, and face shield. Rationale: wound care may involve exposure to bodily fluids. Full PPE helps prevent contamination and exposure. 11. A nurse observes a colleague leaving a patient's room without removing their gown and gloves. What is the best initial action? 1. Report to the manager. 2. Ask the colleague to return and remove PPE properly. 3. Document the behavior. 4. Ignore and proceed with care. Answer: ask the colleague to return and remove PPE properly. Rationale: addressing the behavior immediately helps prevent cross-contamination and reinforces correct infection control practice. 12. Which practice contributes most to preventing central line-associated bloodstream infections? CLAPSI 1. Flushing the line every 8 hours. 2. Using clean gloves to access ports. 3. Scrubbing the hub before access. 4. Replacing the catheter daily. Answer: scrubbing the hub before access. Rationale: scrubbing the hub reduces the risk of introducing bacteria into the bloodstream during line access. 13. A patient asks why the nurse uses goggles during suctioning. What is the most accurate response? 1. Goggles are required for every procedure. 2. They protect against secretions splashing into the eyes. 3. It's hospital policy. 4. It helps me see better. Answer: they protect against secretions splashing into the eyes. Rationale: goggles protect mucous membranes from exposure to potentially infectious secretions during procedures. 14. A nurse is preparing a sterile dressing change. What indicates a break in sterile technique? 1. Turning back to the sterile field. 2. Opening sterile supplies away from the body. 3. Keeping hands above the waist. 4. Wearing sterile gloves. Answer: turning back to the sterile field. Rationale: the sterile field must always remain in view. Turning away risks contamination. 15. A patient is on droplet precautions. Which instruction is appropriate for visitors? 1. No special precautions needed. 2. Wear N95 respirators. 3. Wear surgical masks while in the room. 4. Only enter if asymptomatic. Answer: wear surgical masks while in the room. Rationale: droplet precautions require visitors to wear surgical masks to prevent transmission through respiratory droplets. 16. A nurse is caring for a patient with an open pressure injury infected with multi-drug-resistant organisms. What is the priority action? 1. Clean the wound with normal saline only. 2. Place patient in airborne isolation. 3. Implement strict contact precautions. 4. Use droplet precautions. Answer: implement strict contact precautions. Rationale: multi-drug-resistant organisms spread via contact. Proper PPE and room precautions are essential. 17. During a home visit, a nurse sees a family member discard a contaminated wound dressing in a regular trash can. What should the nurse teach? 1. That is acceptable at home. 2. Use a biohazard bag for disposal. 3. Double bag it using grocery bags. 4. Only nurses can dispose of dressings. Answer: use a biohazard bag for disposal. Rationale: proper disposal of contaminated materials is crucial to reduce infection risk at home. 18. A patient is placed in airborne isolation. What room assignment is appropriate? 1. A shared semi-private room. 2. A private room with negative pressure ventilation. 3. A room near the nurse's station. 4. Any room with a window. Answer: a private room with negative pressure ventilation. Rationale: airborne infections require negative pressure rooms to prevent airborne particles from escaping into other areas. 19. A nurse is caring for a patient with hepatitis B. What standard precaution is essential? 1. Gown and mask at all times. 2. N95 mask during care. 3. Gloves when contact with blood is possible. 4. Protective isolation. Answer: gloves when contact with blood is possible. Rationale: hepatitis B is transmitted via blood and body fluids. Gloves are essential during procedures that may involve exposure. 20. A patient with influenza is admitted. What is the most appropriate transmission-based precaution? 1. Contact only. 2. Airborne only. 3. Droplet precautions. For standard precautions only. Answer: droplet precautions. Rationale: influenza is spread through respiratory droplets, requiring droplet precautions to prevent transmission to others. 21. A nurse is preparing to suction a tracheostomy. Which infection control measure is essential before beginning the procedure? 1. Apply sterile gloves. 2. Use a clean technique. 3. Wear a surgical mask only. 4. Wash hands after the procedure. Answer: apply sterile gloves. Rationale: tracheostomy suctioning requires a sterile technique to prevent lower respiratory tract infections. 22. During discharge teaching for a patient with a surgical wound, which statement by the patient indicates a need for further teaching? 1. I will wash my hands before dressing changes. 2. I can reuse old dressings if they look clean. 3. I'll keep the wound dry and clean. 4. I'll call if I see redness or pus. Answer: I can reuse old dressings if they look clean. Rationale: dressings should not be reused as they may harbor pathogens and lead to infection. 23. A nurse is preparing to insert an indwelling urinary catheter. What is the correct infection control approach? 1. Use sterile gloves and sterile technique. 2. Use clean gloves only. 3. Delegate to a UAP. 4. Lubricate the catheter without gloves. Answer: use sterile gloves and sterile technique. Rationale: catheter insertion requires a sterile technique to prevent introducing pathogens into the urinary tract. 24. A nurse is caring for a client with respiratory syncytial virus, RSV. Which infection control action is appropriate? 1. Use airborne precautions. 2. Place client in protective isolation. 3. Implement contact and droplet precautions. 4. Use standard precautions only. Answer: implement contact and droplet precautions. Rationale: RSV spreads via direct contact and large respiratory droplets, requiring both contact and droplet precautions. 25. A nurse notices a physician entering a contact precaution room without a gown. What is the nurse's priority action? 1. Notify infection control. 2. Provide the physician with a gown and explain the policy. 3. Document the event for inform the charge nurse. Answer: provide the physician with a gown and explain the policy. Rationale: immediate intervention helps correct the behavior and prevents contamination. 26. A client with neutropenia is prescribed fresh fruit. What is the nurse's best response? 1. Allow the fruit if it's peeled. 2. Offer only canned fruit. 3. Restrict all fruit intake. 4. Wash the fruit thoroughly and serve. Answer: offer only canned fruit. Rationale: neutropenic patients should avoid fresh produce due to risk of bacterial contamination. Canned fruit is safer. 27. Which task related to infection control can be delegated to a UAP? 1. Collecting a sterile urine sample. 2. Educating the patient on hand hygiene. 3. Assisting a patient to perform hand hygiene before meals. 4. Assessing for signs of infection. Answer: assisting a patient to perform hand hygiene before meals. Rationale: UAPs can assist with hygiene tasks but cannot assess or educate. 28. A nurse is preparing a sterile field and accidentally brushes a sterile drape with her uniform. What should the nurse do next? 1. Continue using the field. 2. Cover the area with another sterile drape. 3. Replace the entire sterile field. 4. Ignore the incident. Answer: replace the entire sterile field. Rationale: Any suspected contamination requires starting over to maintain sterility. 29. A nurse is removing personal protective equipment PPE after caring for a patient on contact precautions. What is the correct order of removal? 1. Gloves, gown, goggles, mask. 2. Mask, gloves, gown, goggles. 3. Gown, goggles, gloves, mask. For gloves, mask, gown, goggles. Answer: gloves, gown, goggles, mask. Rationale: this order prevents contamination by removing the most soiled items first. 30. A patient with HIV is hospitalized with pneumonia. What type of precautions should the nurse use? 1. Standard precautions. 2. Droplet precautions. 3. Airborne precautions. 4. Contact precautions. Answer: standard precautions. Rationale: HIV is bloodborne, not spread through casual contact or airborne droplets. Standard precautions are sufficient. 31. A nurse is preparing to care for a patient in isolation for chickenpox. Which precaution should the nurse implement? 1. Droplet only. 2. Contact only. 3. Airborne and contact. For standard only. Answer: airborne and contact. Rationale: chickenpox spreads via airborne particles and contact with lesions, requiring both airborne and contact precautions. 32. A nurse is disposing of a syringe after medication administration. What is the appropriate action? 1. Recap the needle before disposal. 2. Place it in a sharps container immediately. 3. Throw it in the trash. 4. Set it aside for the sharps bin later. Answer: place it in a sharps container immediately. Rationale: used needles must be disposed of immediately in a sharps container to prevent needle stick injuries. 33. A nurse is educating staff on surgical asepsis. Which statement indicates understanding? 1. I can turn my back to the sterile field. 2. Sterile objects must remain above the waist. 3. It's okay to cough over the sterile field if I wear a mask. 4. I can touch sterile objects with clean gloves. Answer: sterile objects must remain above the waist. Rationale: anything below waist level is considered contaminated in surgical asepsis. 34. Which infection control action should the nurse prioritize when inserting a peripheral forecatheter? 1. Use sterile gloves. 2. Shave the site before insertion. 3. Clean the site with antiseptic solution. 4. Apply antibiotic ointment after insertion. Answer: clean the site with antiseptic solution. Rationale: proper skin antisepsis is crucial to prevent bloodstream infections during fore insertion. 35. A patient asks why the nurse wears gloves during a blood pressure check. What is the best response? 1. It's required for all vital signs. 2. I wear gloves for every patient. 3. It's not necessary unless contact with body fluids is expected. 4. To avoid touching your skin. Answer: it's not necessary unless contact with body fluids is expected. Rationale: gloves are not required for procedures like blood pressure checks unless contamination is anticipated. 36. A nurse is caring for a patient with suspected meningococcal meningitis. What is the appropriate infection control measure? 1. Standard precautions. 2. Contact precautions only. 3. Droplet precautions. 4. Airborne precautions. Answer: droplet precautions. Rationale: meningococcal meningitis spreads through respiratory droplets. Droplet precautions are required. 37. A nurse is entering a room of a patient with scabies. What PPE is required? 1. Gloves only. 2. Gown and gloves. 3. N95 mask only. 4. Face shield only. Answer: gown and gloves. Rationale: scabies is transmitted through direct skin contact and contaminated linens. Contact precautions apply. 38. Which of the following actions helps prevent ventilator-associated pneumonia? VAP1. Suctioning once per shift. 2. Placing a patient in high Fowlers. 3. Elevating the head of the bed 30 to 45 degrees. 4. Turning off humidification. Answer: Elevating the head of the bed 30 to 45 degrees. Rationale. Elevating the head of the bed reduces aspiration risk, which is key in preventing VAP. 39. A nurse finds a sterile dressing left open on the bedside table for an hour. What should the nurse do? 1. Use the dressing if it looks clean. 2. Apply the dressing with clean gloves. 3. Discard and obtain a new sterile dressing. 4. Cover it with a clean towel and use it. Answer. Discard and obtain a new sterile dressing. Rationale. Once exposed to air for an extended time, sterility is compromised. Discard and replace. 40. Which infection control strategy is most effective in reducing hospital-acquired infections? HAIs 1. Wearing gloves for all patient contact. 2. Using hand sanitizer occasionally. 3. Strict adherence to hand hygiene protocols. 4. Isolating all patients. Answer. Strict adherence to hand hygiene protocols. Rationale. Consistent and proper hand hygiene is the single most effective way to prevent HAIs. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.